will start with posture analysis. Just stand how you would normally. Shake it all out. Okay. My hand with the arm, the shoulder. I'm saying sway, but it's only a quarter of an inch. And if sway was greater than a quarter of an inch, that would be indicative of a cat 1. Okay, would you turn and face away from me, please? Okay, just shake it out again, how you did before. Okay, and then just stand normally. And sit down and line up with the S2 tubercle and see if he has any lateral sway. And I am seeing lateral sway, but it's less than a quarter of an inch, so that's completely normal. If it was greater than that, that would be indicative of a cat 2. And if he had no movement, no sway, that would be a cat 3. Okay, will you sit here for me? Okay. So now I'll do first rib and put my hands on the TVP. And will you flex and extend your head for me, please? Okay, and I'm feeling to see if the first rib will kick back. If it does on one side unilaterally, that would be indicative of a cat 2. And if it did it on both sides, that would be a cat 1. And if there was no, or if both sides did bilaterally, that would be a cat 1. If neither side did it, that would be a cat 3. And cervical indicators. Will you lay on your back for me, please? Okay, so for the cervical indicators, I would do, if there was bilateral tenderness at C3, that would be cat 1. If there was unilateral tenderness at C4, lamina, lamina for the first part as well. C4 left lamina tenderness, that would be a cat 2. And then for cat 3, you would use the Lover Brothers principle, and TVP tenderness would correspond with lumbar rotation, and spinous process tenderness would correspond with TVP lumbar inferiority on that side. After that, we'll do the cervical compaction test. So I'm going to raise your head off the table, and will you put your ankles together and lift your, you can put your hands to your side, and lift your feet off the table 18 to 24 inches. Okay, thank you. And know how difficult that was. And now I'm gonna push S to I on your head and do the same thing. And which one was easier?
The first.
Okay, the first one was easier, which means that there is no cervical, no primary cervical issue here. If it was easier with the cervical compaction here, then that means that it would be a primary cervical issue. Other than that, I would do, okay, the correction for that would be cervical stair step. So lift your head up here, and I'll push I to, or S to I, and it would go in a PA. Okay, and then I would just use an arcing motion. Cervical stair step here, and I would see which one of those steps wasn't as smooth as the other ones. The first step is C7T1 and C5-6, C3-4, C2-1 for steps 1, 2, 3, and 4. If there was an issue at step 1, then I would check for anteriors, and I would also do the figure 8 motion, and I would do it in both directions. That would be for step 4. Step 5 would be basic 1 and 2. So I would put my hands inferior to the inferior nuchal line, and I would feel for the flow of CSF to balance out from hand to hand. I would use a flat forefinger contact. That would be for basic 1. Basic 3 would be to palpate along the sagittal suture, feeling for a spot of tenderness, the most tender spot. I will cross my thumbs at that place and put these 4 fingers on the parietal, and then I will have you inhale for me and exhale. Okay, and after that I would do psoas. So will you put your hands up for me? Okay, and use straight fingers, and I would grab his arms below the wrist. I would stand squared off to the patient. I would pull, straighten your fingers out for me, put your hands together, and see which side is short. He has a right short, so I will go to the contralateral side. You can relax now. So for basic 1 and 3, will you lift this knee for me? Okay, so basic 1 and 3. Here. Is it okay if I touch you where your psoas would be? It's kind of a sensitive area. Okay,
Sure.
cool. So I'll just use the base of my hand, and I'll have you inhale and exhale for me. So as he inhales, I would go lateral, and as he exhales, I go medial. And I would push down, and again for me, and I would hold the depth, and as he exhale, I would go deeper each time. Okay, thank you. And for basic, that was 1 and 3, for basic 2, is it okay if I reach under your knee to stabilize your hip?
Yes.
Okay, so I would reach under, stabilize the hip, and do the same thing when you inhale and exhale. And as he exhales, I would apply force and hold it, inhale. And each time he exhales, I would just apply more pressure. And I have the anterior iliofemoral ligament. I'll turn both of his ankles, both of his feet medial. They should go about 45 degrees. This one doesn't go as much comparing side to side. So this is the side that I would be on. I'll stand on the contralateral side, and I would go posterior and inferior to his hip, and I would stack my fingers. Will you turn your foot internal for me, all the way in? Okay, and then come out slow. Okay, and again for me. And come slow. And on this last one, on the count of 3, go out really, really fast. So 1, 2, 3. And I just use a small thrust for that. And the last thing would be the arm fossa test. Okay, so just have your arm up for me. Just with a soft fist, no white knuckles, soft fist, and have your thumb pointing that way. Cool. So I would say hold, touch, pull, and let me just test and see if this is a strong muscle. So hold, and it is. And I'll be touching a sensitive area along with your inguinal ligament. Is that okay?
Yep.
Okay. And I'll make sure that I use flat 4 fingers, and I'll use upper fossa, lower fossa, making sure that they neither of the fossas overlap. So hold that for me, and I will palpate, touch the fossa, and pull, and that is strong. And hold, touch, pull, that one is strong. And I will do the opposite side. And this test is definitive for category 2 if he had a weak fossa.